Ladies and gentlemen, thank you for standing by. Welcome to the LA County COVID-19 update. At this time, all parties are in a listen-only mode. Later, we will conduct a question-and-answer session. Instructions will be given at that time. If you should require assistance during the call, you can press star and then 0. I'd now like to turn the conference over to our host, Supervisor Kathryn Barger. Please go ahead.
Good afternoon, and thank you for joining us. I'm Supervisor Kathryn Barger, Chair of the Los Angeles County Board of Supervisors. Yesterday, Governor Gavin Newsom and State Superintendent of Public Instruction, Tony Thurmond, recommended the California schools stay closed for the remainder of the school year. I know the decision was not made lightly, but doing so will help schools, teachers, and students make plans for the rest of the semester so we can ensure students have computer internet access to support distant learning. Additionally, this helps school districts prepare for meal programs and supportive services to aid vulnerable families. Dr. Deborah Dorado, the Superintendent of Los Angeles County Office of Education, is here to speak in more detail about how the county is supporting our 80 school districts with resources. We know this announcement may have caused stress for parents who are now tasked with facilitating online learning for their children. We are joined by Director Bobby Cagle of the Department of Children and Family Services to provide parents and caregivers with positive parenting techniques and supportive programs. In our own ways, we are all navigating guidelines that have immeasurably changed all of our lives. LA County is here to support and to provide the tools you need to survive throughout this crisis and even thrive. Thank you all for your patience and support as we keep all of our communities safe. We are all in this together, which is the only way that we will get through this. Now, I would like to introduce Dr. Barbara Ferrer, our Director of Public Health, who will give us the latest updates for today. Thank you.
Thank you very much, Supervisor Barger, and thank you to everyone who's working so hard across the county to really slow the spread of COVID-19. I want to update you on our current status. I'm sad to report an additional 13 deaths today. 12 of the people who passed away were over the age of 65, and 11 of the people who were over the age of 65 did have underlying health conditions. There was another death of a person who was younger, between the ages of 41 and 65, and this person also had underlying health conditions. This brings the total number of deaths to 78 in LA County, and our mortality rate for COVID-19 has slightly increased to 1.9%. 86% of the people positive for COVID-19 who have passed away did have underlying health conditions. For those of you who are mourning family members and friends, we're deeply sorry, and our thoughts and prayers are with you every day. Today, we're also reporting 534 new cases. That means that over the last 48 hours, we've had over 1,000 new cases here in LA County, and our total number of cases is 4,045. These cases include 139 cases reported by our partners in the city of Long Beach and 37 cases reported by the city of Pasadena, both of which have independent city health departments. We're also reporting amongst our count that 9 people are confirmed cases for people who are experiencing homelessness. 78% of all of our positive cases are occurring between people who are aged, of the ages between 18 and 65. And this has been a pretty consistent number since the beginning. About almost 900 cases at some point of people who've been positive for COVID-19 have needed to be hospitalized, and that also slightly increasing the number now to 22% of positive cases have needed at some point during their illness a hospitalization. Currently, there are 241 people hospitalized for COVID-19, and 153 of these people are 55 and older, and 108 are older than 65 years old. 2/3 of all the people that are currently hospitalized who have a diagnosis of COVID-19 have no underlying health conditions, and they're dispersed across all age categories. So I want to be clear that while most significant death and serious illness does occur amongst people who are older and people with underlying health conditions, all people who get infected with COVID-19 at any age can have very serious illness, and that could mean that they're required to have a hospitalization. 28% of people who are hospitalized today are in the intensive care unit, and 34% of those in the intensive care unit are over the age of 65, and over 55% of folks in the intensive care unit have underlying health conditions. But I do want to note that 5 people in the ICU are under the age of 35, and a couple of the people who are young don't have any underlying health conditions. As always, you can see an updated report on the LA County cases on our website, www.publichealth.lacounty.gov. I also want to provide the update on investigations in institutional settings. Our number has jumped. We're now investigating at 54 different settings. At each one of those settings, we have at least one confirmed case of COVID-19. These institutional settings include nursing homes, assisted living facilities, shelters, treatment centers, supportive living, jails, and prisons. The total number of confirmed cases in institutional settings has also increased to 298 people. This includes both staff and residents or guests. 175 of these confirmed cases are among residents or guests, and 114 are among staff. We're sad to report that 11 people who have died from COVID-19 have resided in either a skilled nursing facility or an assisted living facility. At the county jail, we currently have 7 cases. 6 of these cases are among staff, and 1 is amongst a person who is incarcerated. The Lancaster State Prison has 6 positive cases amongst inmates. In our shelters, there are still only 2 shelters where we have confirmed cases of people who are positive for COVID-19. That's 2 staff people and one guest at the shelter. I want to explain a little bit for a minute about what happens at the shelters when we identify a positive case. If we're able to, we quarantine at the shelter everybody who's been exposed, and sometimes at a smaller shelter, that could mean we would be quarantining the entire facility. But we also will go in with and identify who are the people most vulnerable who have had an exposure, and we move those people to an isolated site for them to serve out their quarantine. Right now, today, we just moved 22 persons experiencing homelessness who had an exposure at one of the shelters to their own individual rooms in one of our facilities that manages to offer places for people who are experiencing homelessness to either isolate or be quarantined. As of April 1st, we've tested over 23,300 people, and 13% were positive. I want to note that I think that number is slightly inflated because we still have a couple of labs that are not giving us the reports on the number of negative tests that they have processed. And again, the increase in the number of people who are positive here in LA County still directly correlates to our ability to do more testing. It also, though, unfortunately correlates to the fact that we have more people who are infected, and because we have more people who are infected, we have more people infecting other people. We've seen a lot of improvements in testing, and I want to again thank Dr. Kazan and his team, but it remains critical that we be able to prioritize testing for those most in need, and that means that we still ask that you have a lab order from a physician that in fact says it's appropriate for you, it's clinically appropriate for you to be tested. At this point, for everyone who's not experiencing any symptoms, we ask you in particular to wait about getting tested. If you have no symptoms and you test negative today, it will say nothing about your status tomorrow. Again, for people who have no symptoms at this point in time, best to let testing happen amongst those people who are in fact symptomatic. Yesterday, I discussed the fact that that both the Centers for Disease Control, the National Institutes for Health, the governor, and the mayor have all spoken about the possibility of us rethinking our advice around who should be masking and when. So I want to start by reminding all of us that there are some people who absolutely have to mask, and we all need to make sure that they have the masks that they need in order to do their jobs. And those are our frontline healthcare workers. Frontline healthcare workers need access to N95 masks. Nobody else who's not a healthcare worker needs access to an N95 mask. So as I speak about the guidance that says that it might be appropriate for you to cover your nose and mouth when you're out, I want to be crystal clear that nobody in the public should be going after getting an N95 mask. Those need to be fit tested, and we have a short supply, and we must have them for our healthcare workers so that they can be protected when they protect us when we need care, medical care. It may be appropriate if you're out and you're not able to do all the social distancing that we've asked you to do. If you're not staying 6 feet apart from people when you're, for example, at the pharmacy or at the grocery store, it is probably a good idea, given the evidence that says that you could be asymptomatic and still infectious, for you to cover your nose and mouth. But we would ask that you go online and you see how to make your own mask. They're very simple to make. There's nothing fancy about them, but that will mean that then the supply of surgical masks is available for all of the essential workers who need that to do their job, for all the sick people who need to wear one so that they don't expose anybody else to their infections, and to anybody who needs to have close contact because they're a caregiver or they live in a family where they're caring for someone who's ill. We still don't have enough surgical masks, so while the guidance is clear at this point that it's probably beneficial if you're out and about and you're going to be in contact with others as you get your essential services, that you do put a covering over your face and over your mouth and your nose. You don't really need to use up the short supply of either surgical masks or, in particular, the N95 masks. So it's really important that folks understand that while the guidance suggests that it would be beneficial to mask up when you're out and about, we're much clearer on the benefits that accrue if you do everything else we've asked you to do. Most important is social distancing. You're not going to spread germs if you're not close to people. That 6-foot barrier is essential for us to maintain, even if we're masked. I don't want people to get a sense of security. Oh, I've covered my nose and my mouth, and now I can just be out and about. That is not what we're saying. You must keep that social distance. The mask will not protect you 100% particularly from infecting others, which is really all that they are appropriate for. You need to wash your hands. Washing your hands is still the most appropriate action you can take to prevent germs from getting inside you. So wash your hands, don't touch your face unless your hands are clean. And make sure you're following all of our orders around self-isolation and self-quarantine when they're appropriate. If you're sick or if you're a close contact of a person who is sick, either with a diagnosis of COVID-19 or a possible diagnosis of COVID-19. So as we know more about COVID-19, the guidance will change. We changed it this week. It's likely that as we learn more, it will also change into the future. So I want to just make sure that we're clear about what's not changing, which is your need to stay home as much as possible. So there's been no change in that, and there's unlikely to be any change in that in the weeks to come. So please only go out to access essential services. And when you do go out, even if you have a homemade mask, we need you to practice social distancing as much as possible. We do have weeks to go, and I thank you for all you're doing to prevent becoming infected and prevent others from becoming infected. And I know it's not easy, and that these circumstances are unprecedented for our entire community. But we are all in this together, so it makes sense that we work together to get through this. Please don't lose hope, and please don't stop following all of the directives that you are following right now to slow the spread of COVID-19. I thank you from the bottom of my heart for all that you're doing. And now it's my pleasure to introduce Dr. Eduardo, the Superintendent of LA County's Office of Education.
Buenas tardes, good afternoon. We are all so grateful to our health workers, first responders, and essential workers that are making sure the county emergency operations and essential services continue. To protect them, the rest of us have to make some sacrifices. Yesterday, I announced that I was recommending the physical closure of schools through the end of the school year. This decision aligns with Governor Gavin Newsom's and State Superintendent Tony Thurmond's statements that students will not be returning to school this year. This is not what any of us could have imagined. We all had great hopes for a strong end to the school year, with seniors crossing the stage with excitement, cheered on by proud parents, families, and friends. None of us anticipated a pandemic that would close down our schools and require all of us to physically distance ourselves from others. I want to be clear that my recommendation includes a strong message that learning will continue and that educators are committed to providing quality instruction, even if it has to be from a distance. To our students, please take this new method of learning seriously and understand that instruction is not optional. Your teachers have high expectations that you will continue to study and grow academically. Our public health leaders have made it very clear that the peak of this pandemic is yet to come. As social distancing practices remain vital, the safety of students and staff must be our top priority. Deciding to keep campuses closed for the remainder of the school year allows our education community to focus on accelerating learning in a remote environment and finding ways to engage and connect with our students. Because every student should be in regular contact with either a teacher, a counselor, or an administrator to make sure they are safe, ready, and able to learn from home. The LA County Office of Education will continue to bring together educators from across the county to develop a comprehensive plan to address a range of issues in addition to distance learning, including high school graduation, grading, special education, reopening of our schools, and summer school offerings. One thing that all educators agree on, both K through 12 and higher education, is that students should not be penalized because of this virus. All of us are working together to ensure flexibility around graduation requirements for our seniors and college admission. We realize that not all students have access to the internet and/or the devices they need as we move to a more rigorous online instructional model. So we are working with the private sector to ensure that all children have the tools they need to learn and that no child is placed at a disadvantage. We are also working with districts to make sure that school meals continue throughout the school year and working with many partners to have childcare available for health workers, first responders, and other essential workers using existing early childhood education facilities. We received confirmation that our colleges, our UCs and CSUs, are relaxing its fall 2021 admission standards for applicants who are currently high school juniors, including suspending the requirement that they take standardized tests. For seniors, they are allowing a pass-fail for grades for this spring classes affected by the coronavirus pandemic. I know that this recommendation places many challenges on parents, on students, and on our educators. However, it's what we need to do to slow the spread of this virus and keep our children safe. I'm confident that by working together, we will be able to overcome this and best support the students in LA County, 1.5 million students in 80 districts that are working very hard to accomplish these goals together. Thank you. And now I would like to introduce Bobby Cagle, our Director for the Department of Children and Family Services.
Good afternoon. During this time of heightened uncertainty, we at the Department of Children and Family Services recognize the stressors that families may be experiencing. This is a challenging time for our community, and it's very understandable that many of us may have a great deal of anxiety. I want to assure you that DCFS is working around the clock to assess and assure the safety of children, our staff, and the families that we serve through a variety of measures. Family dynamics during a time like this will naturally be impacted because schools are out and most people stay home for an extended period of time. This situation is sure to test the limits of even the most patient individuals at times. But I want to emphasize that there are services available in the event that you need them. In particular, there are a variety of services available through a network of providers known as prevention and aftercare programs. They are geared towards strengthening and supporting families. These are available to all residents of LA County and are free to families regardless of age, immigration status, or insurance status. Prevention and aftercare is a family-driven model that encourages families to define what they need and to develop a plan to achieve those. Further, families are eligible to participate for as long as they are needed. Prevention and aftercare seeks to ensure children are safe by building parental capacities and helping families navigate difficult circumstances. The program targets families who may be particularly vulnerable and could potentially become engaged with DCFS without support. Providers are available throughout Los Angeles County. Although availability varies by agency, some of the services offered include parenting support and education, linkages to needed services, services or goods for basic family needs, for example, food, parent-child and family-centered activities, financial literacy programs, neighborhood and community action groups, and peer support groups. During this time of recommended social distancing, many of the support groups and other services offered through Prevention and Aftercare are now available through Zoom, Skype, FaceTime, and other distance technologies. While our operations and those of our providers may be modified now, I want to stress that we are still here to help and connect families to resources. I encourage anyone who can use some extra support to reach out to DCFS to find out what services are available in their area. Further information on these services can be found on our website at www.dcfs.lacounty.gov. DCFS has a dedicated team in place monitoring developments and helping to provide updates whenever possible. We are committed to keeping the lines of communication open and regularly post updates on our social media and DCFS website. Again, we are here to help, and I'm confident that together we will get through this. Thank you very much, and now, Brad, we are ready for questions.
Thank you, and ladies and gentlemen, if you do wish to ask a question, please press 1 and then 0 on your telephone keypad. You can withdraw your question at any time by repeating the 1-0 command. Once again, if you have a question, it's 1-0. And first, we'll go to the line of Dave Lopez. Please go ahead.
Hey, Dave.
Yes, good afternoon, everyone. Doctor, I know you said a couple days ago that you're crunching the numbers to get your own version of where this is going to go. Is that going to be doable this week? And exactly what is it telling you? And one other quick point. I know you've answered this before, but there are a lot of people. You are our Dr. Fauci locally. Is sniffling. You told us before it is hay
I have
fever.
allergies.
Please tell us that's all it is.
Yeah, no, I have allergies. I'm really sorry. And sometimes when the weather changes, the allergies get bad. So, but I appreciate your reminding me to let people know, no, I'm not sick. I have bad allergies, and I'm sorry for the sniffling.
No need to apologize, Doc.
Yeah.
We just need to keep you healthy, that's all.
Yeah, no, I'm fine. Thanks so much for the concern. So the question on the modeling is a good question. We have been working with both the Department of Health Services and some of their clinicians, and with UCLA and some of their researchers, and we feel really good about where we are on using some of our own local data to do the modeling. We've looked at some first runs. We're making some adjustments so that the inputs actually line up with the data that we're sharing across the various departments here. And I do hope that if it's not tomorrow that we're able to talk more about it, it certainly will be by Monday, that we'll be able to just sort of share with you what we're finding from the modeling that's done specifically here for the county. Again, using some of the modeling techniques that have been used in all of the other studies, but very specific to the situation here in LA County. Next question.
Our next question here will come from Claudia Prosciutto with KNX Radio. Please go ahead.
As usual, I have a few questions. So you mentioned 54 investigations involving institutions. I'm wondering how many of those are confirmed outbreaks. Also, you mentioned the 6 LASD jail staff who've tested positive. I'm wondering if there are any other cases among LASD employees and the fire department, if you can say. And then I'm wondering if there's any meaningful contact tracing happening at this point, or is it just too late for that?
Oh, sure. Those are all good questions. Let me go through them quickly. The question about the jail, I can confirm just based on what's reported and from test results that we have those same 6 staff people that are positive. If you wanted other numbers for either the sheriff's department or the fire department, again, I urge you to talk specifically with those departments about that data. In terms of the institutional investigations, we investigate when there's just one case in an institutional setting. But I think when we post online, I think we do note if it's considered an outbreak. For us, it's 3 or more cases at an institution is considered an outbreak. And if we're not noting that, Claudia, I will make sure that we start denoting where there are outbreaks. And obviously, in some situations, we've had many more than 3 cases at just a handful of our institutions. But I know that everybody's doing all they can to make sure that we're doing our best to take care of residents and guests in those institutional settings. And your last question, remind me what that was?
About contact tracing.
Oh, yeah, no.
Contact tracing.
Sure, we are still doing contact tracing. So we've just trained another 300 people at our department, have been reassigned to help us contact every case that's identified as positive and really note where there has been a high-risk contact of that case. So again, we rely on our positive cases to obviously take care of people and their families, but we like to know if either the case or any of their contacts were in either high-risk settings or high-risk individuals, and then we do the follow-up. So again, as I've noted, I have about 300 people working on that now. We'll take the next question.
Thank you. And we'll go to the line of Melanie Mason with Los Angeles Times. Please go ahead.
Hi, Dr. Ferrer. With regard to the cases that you've mentioned for people experiencing homelessness, is there any additional geographic information you can give us about where those cases are distributed throughout the county?
I don't have that information, and I'm not sure how accurate that information would be, but I can look and see what we're collecting and whether there's any bearing, because as you know, people experiencing homelessness are often in multiple locations. But let me talk to our team and just see how best we can answer questions around. I'm sure you're particularly interested in whether we have any clustering. To date, we don't, but obviously our numbers are still small. But we'll take the next question.
Thank you.
And we'll go to the line of Annabelle Munoz with ABC TV. I'm sorry, ABC 7. Please go ahead.
Hi, Dr. Ferrer and Supervisor Barger. I have a question about testing in terms of what the county is doing, if it's partnering with any agencies to expand access to testing, specifically in underserved communities where many people are uninsured. We're trying to make sense of all of these numbers, which is very difficult right now. But we're wondering if maybe the higher number of confirmed cases in some areas has more to do with access to testing.
So I'm going to let Dr. Ferrer talk about the second part of that, but under the leadership of Dr. Kazan, we actually authorized purchase of additional kits, and we are targeting areas such as the Antelope Valley, out in the Pomona area, down in South Bay, areas that otherwise have not really had access to the testing. So clearly we are trying to put it into areas that are that have not had the access that maybe some of the what's perceived as more affluent areas have had. So that has been a priority with Dr. Kazan, and I know that come Monday, we are going to have that whole process in full effect. But I'm going to let Dr. Ferrer talk about the second half of that. And if you wanted to follow up with any specifics, Dr. Kazan is the expert on this and is rolling out the entire plan. And we're working with places like Providence, who has been an incredible partner, as well as some other nonprofits that are helping us as well. Dr. Ferrer?
Yeah, I think it's a really good question, and you know, I've tried to continue to answer this as honestly as I can with the data that we have, and we're obviously trying to do a better job understanding the data. I think there's like multiple things at play around the testing. One thing we do know is that everybody who is hospitalized and tested positive for COVID-19 is sort of it has an equal opportunity at getting tested. So if you're severely ill and you end up in a hospital, you are going to get tested regardless of what part of the county you come from. So I want to reassure everyone that it's the testing is not limited for people who are seriously ill and requiring medical care, especially hospital care. Everybody who goes into the hospital and needs to get tested for COVID-19 is in fact getting tested for COVID-19. And I'm grateful for all the work that the hospitals are doing to increase their capacity to be able to do that testing rapidly in their own labs, as well as to use some of the new commercial vendors that are online. I do think that when you see the rates are so different by different places, one thing I want to caution everybody is there's still relatively small numbers in some of our communities. And, you know, from a scientist's point of view or a researcher's point of view, that means that the confidence intervals are really, really large. So I would just say, you know, read those charts with some caution around what the rates are telling us. The other thing that we know is that in some of our communities, people traveled a lot early on when the outbreak was particularly acute in places in Europe. And those people came back to our communities, and they also may have infected other people in their community. And that could be, that travel effect is still at play. I don't think it's just a testing effect. I think there's a couple of things that are at play in those higher rates. And as we do more testing, though, obviously, I think the supervisor said it best. You know, where people need to be tested because their clinician has decided that they need to be tested, there should be no barriers to them being able to access both a place to collect the specimen and then a fairly rapid turnaround in getting those results back so that they can take the steps they need to protect themselves, protect their families, and get the kind of medical care that's appropriate. But thanks, and we'll go on to the next question.
And that'll come from line of Steve Gregory with KFIN News. Please go ahead.
Hi, Barbara. Good afternoon, and I apologize in advance for rapid-fire questions because sometimes we get cut off. I wanted to ask you, you were talking about face coverings, and you know, the city is partnering with the garment industry to do these face coverings. Are you involved in that at all in sort of manufacturing these face coverings for non-essential people, or does the county have any plan for that, anything like that? The other question I have, the 10-minute window you discussed, you talked about the fact that people have to sort of be under the 6-foot distancing for about a minimum of 10 minutes before anything happens. Is that 10 minutes the magical number? Like if you're in an elevator, we were getting people that seem to be confused about the 10-minute rule. And also, is it possible to start including stats, positive cases from both the fire department and sheriff's department on your daily briefings? Thank you.
Okay, great. I'll talk about the last request. I think that's up to the fire department and the sheriff. I'll pass that request along. The 10-minute rule, it's sort of an arbitrary number. It means that this virus is most efficiently transferred when someone has had prolonged contact, and it's probably not easily transferred at all if you're just walking by somebody. But I too have gotten questions about the elevators, and I would urge people to wait for the next elevator and not get into an elevator where you're going to be packed in with other people. That's just a bad idea in general. So people in the elevators should try to do some spacing. In those smaller elevators, 1 or 2 people at a time is perfectly appropriate, especially if there's no urgency for somebody to get to or from a location. But the question on the 10-minute rule, I think it's an important one. What it really was meant to capture that, in general, the virus is transmitted when you've had a significant exposure to the virus. So somebody's respiratory droplets. But it also, you can imagine, it really only takes a tiny bit of the virus for you to get infected. It's just your chances of getting infected go up pretty significantly when you're in close contact. So that 10-minute rule really doesn't mean like, oh, it's okay, get really up close and personal with people for 5 minutes because you have nothing to worry about. It's really meant to say, please don't get up close and personal with anybody you don't have to. And if you're going to get up close and personal, know that you're both taking a risk, and you should minimize that in all of your contacts. So thank you, and face coverings. I really applaud the mayor, and I really also want to applaud all of the entrepreneurs who are going to work hard to create face coverings for people to use that don't really wreck the supply of surgical masks and N95 masks that are needed for essential workers and healthcare workers. And I'm 100% in favor of that. I know that the county has been partnering effectively with the city on a variety of efforts, and I know that this partnership holds for everything that we're doing as we're moving forward. So thanks so much for your questions. Next question.
Thank you, Barb.
And we'll go to the line and Ryan Carter with LA Daily News. Please go ahead.
Okay, Gabriella. Thank you. Hi, Doctor. Thanks very much for these. Couple of questions here. Regarding COVID testing sites, we're starting to see some clinics and smaller providers popping up around the county and the city. This is aside, of course, from the city and county network of testing sites. Do you have any concerns about whether the tests that are being offered here are FDA approved, and wondered if you had, you could speak to the quality of testing going on at sites that are not city and county sites, whether there's concern about false negatives and stuff like that.
Yeah, thanks so much. I know that there was an article in one of the papers earlier today that talked about this issue about, are these tests as accurate as we would want them to be? I think in general, everybody wants the tests to both only give you a small number of either false negatives or false positives. And with all the tests, we tolerate, we always tolerate a small number of false negatives and false positives. There's almost no test that's 100% accurate 100% of the time. We generally like our tests to be 95% accurate. So if I test negative at 1 o'clock today, I want to test negative at 3 o'clock today. And if I tested positive, I want the same thing. That's what we mean by wanting the test to be accurate. But again, we know that there's always a margin of error in all of the tests. I think if anybody has gotten tested and you look at your lab results, you always see sort of a disclaimer that this could in fact be a false positive or a false negative because of that sort of small margin of error. So I think what we're looking for are having tests that are what we call reliable and valid, that they're meeting that 95% threshold, so that the general public can have the assurance that I'm getting tested and this is likely to be a pretty accurate result. I will tell you from a clinician's perspective, oftentimes if they have a patient who has tested negative for anything and that patient's symptoms persist, they might order a second test, and that would be certainly appropriate in this situation as well as in others. So again, we strive for these tests to be as accurate as possible. We look forward to working with all the commercial labs. We're grateful for everybody who's stepping up. But I think you're right. We want there to be accurate testing. Thanks a lot. We'll take the next question. And it's the final question.
Jim, your line is open.
Did you say Jim Roop?
Correct, Jim Roop with Westwood One News.
I'm very sorry. Thank you very much. Doctor, and maybe Supervisor Barger, you can chime in on this one too, if you would. But, Doctor, you said we still have weeks to go. So I'm wondering, because of the comments I've heard from the President, from the Governor, April seems to be a make or break month. Would you categorize, both of you, first Doctor and then Supervisor, if you could, because how does this look on the county side? But would you categorize April as make or break?
I'm not sure what everyone means by make or break, so let me tell you how I characterized April. We're going to see more cases, and what I'd like to see is not a huge acceleration of cases in April. And obviously, if we started seeing that huge acceleration, it would cause some additional worry for all of us. But I don't think there's nothing make or break or magic about April. What we're going to see are more cases, and the question is, are we able to have that increase be at a manageable level? Because if we're not, we'll overwhelm. We'll overwhelm our healthcare system. But I'll let Supervisor Barger talk.
I'll take over from there. And I agree with Dr. Ferrer. Obviously, you know, I look at the numbers, and I also look at the percentage that relates to those that are being hospitalized. And I'm always cautiously optimistic that the Safer at Home is working, but I don't want us to let our guard down. I believe that April for LA County is going to be important to ensure that we slow down the spread. And so to me, that is a make or break, but not in the way that some people may perceive it. I mean, I really do believe that we have the opportunity to flatten the curve, and it looks like we're doing that. Look at the numbers today. They're pretty steady as they were yesterday. As testing ramps up, obviously those numbers are probably going to go up, but I believe we all have an obligation to protect our communities, and you know, April is going to be the month that is going to really tell me that the Safer at Home has worked, and we've kept individuals safe. And then as it relates to the testing, I wanted to give out this for frequently asked questions. If people want to know about testing, they can go to covid19.lacounty.gov, and under frequently asked questions, there is a link to Drive Up mobile testing, so that people know how they can sign up for the Drive Up testing throughout the county. And I would encourage you to go and take a look at that. But again, make or break is you know, different things, different people. But for me, it's about Safer at Home, working across the line to make sure that we keep the hospitalization down and the rate of spread down as well. So with that, I'm going to now ask that the remarks be made in Spanish. Thank you.
Too much talking. Sorry about that. Too much talking. So buenas tardes a todos y gracias a la supervisora Barger y todos nuestros líderes por su fuerza y su trabajo. Para actualizarlos sobre nuestro estado actual, estamos tristes de nuevo de reportar 13 muertes adicionales hoy. 12 de estas personas tenían más de 65 años y 11 de las personas mayores tenían afecciones de salud subyacentes. La otra muerte fue una persona entre las edades de 41 y 65 años que tenía condiciones de salud subyacentes. Esto eleva el número total de muertes en el condado a 78 78 personas y nuestra tasa de mortalidad para COVID-19 es de 1.9%. Para aquellos de ustedes que están en luto por familiares y amigos, lo sentimos profundamente. Nuestros pensamientos y oraciones están con ustedes. Hoy también estamos reportando 534 casos nuevos y el número total de casos en el condado de Los Ángeles ahora es el 4,045. Estamos reportando también 9 casos confirmados entre personas sin hogar. El 108% de todos los casos positivos ocurren en personas entre las edades de 18 y 65 años. Este ha sido un número constante desde el principio. 879 casos han sido en algún momento hospitalizados. El 22% de todos los casos positivos han sido hospitalizados. Y también te quiero dar un poco de información que estamos ahora investigando en entornos institucionales. Hay como 54 entornos institucionales que tienen al menos un caso confirmado de COVID-19. Estos incluyen hogares de ancianos, instalaciones de vivienda asistida, refugios, centros de tratamiento, viviendas de apoyo, cárceles y prisiones. En total, los casos confirmados en entornos institucionales es de 298, incluidos tanto el personal como los residentes. Hay 175 personas confirmados que son residentes y hay 114 personas que son empleados. En el cárcel del condado tenemos 7 casos. 6 son empleados y una persona está encarcelado. En la prisión estatal que queda en Lancaster tiene 6 reclusos que son positivos para el COVID-19. Sobre las pruebas, a partir de ayer más de 23,300 personas han sido evaluados en el condado de Los Ángeles y el 13% de ellos fueron positivos. Quiero terminar de hablar con ustedes pidiendo las gracias a todos, pero también quiero explicar que todos nosotros tenemos semanas para ir y tenemos que estar aquí juntos. Yo sé que esto no es fácil. Estas circunstancias no tienen precedentes para nuestra comunidad, pero estamos todos juntos con ustedes. No quedan semanas antes de llegar al otro, nos quedan más semanas antes de que llegamos al otro lado, pero no pierda la esperanza y no deje de seguir todas las directivas que retrasen la propagación del COVID-19. Le agradezco desde el fondo de mi corazón por todo lo que están haciendo en este esfuerzo. Y ahora vamos a oír con la doctora Eduardo, la directora de la Oficina de Educación del Condado. Muchas gracias.
Buenas tardes. Primero quiero dar las gracias a nuestros trabajadores esenciales que se aseguran de que continúan las operaciones de emergencia y los servicios esenciales del condado. Y es por ellos que tenemos que hacer algunos sacrificios. Ayer anuncié mi recomendación de mantener las escuelas cerradas hasta el fin del año escolar. Esta decisión sigue con las declaraciones del gobernador Gavin Newsom y del superintendente estatal Tony Thurmond de que los estudiantes no regresarán a la escuela este año. Esto no es lo que ninguno de nosotros podría haber imaginado. Todos teníamos grandes esperanzas de terminar el año escolar con nuestros estudiantes cruzando el escenario con entusiasmo, alentados por orgullosos padres, familias y amigos. Quiero dejar en claro que mi recomendación incluye un fuerte mensaje de que el aprendizaje continuará y que los educadores están comprometidos a seguir con la instrucción de calidad, aunque tenga que ser a distancia. Para nuestros estudiantes, por favor, tomen en serio este nuevo método de aprendizaje y comprendan que la instrucción no es opcional. Sus maestros tienen altas expectativas de que continuarán estudiando y creciendo académicamente. Nuestros líderes de salud pública han dejado en claro que el pico de esta pandemia aún está por llegar. Las prácticas de distanciamiento social siguen siendo vitales. La seguridad de los estudiantes y el personal debe ser nuestra prioridad. La decisión de mantener las escuelas cerradas durante el resto del año escolar permite a nuestros educadores concentrarse en acelerar el aprendizaje a distancia y conectarnos con nuestros estudiantes. Cada estudiante debe estar en contacto regular con un maestro, consejero o administrador para asegurarse de que esté listo y capaz de aprender desde casa. La Oficina de Educación del Condado de Los Ángeles continuará reuniendo a educadores de todo el condado para desarrollar un plan para solucionar una variedad de problemas, como graduaciones, calificaciones de estudiantes, la reapertura de las escuelas y aprendizaje en el verano. Una cosa en la que todos los educadores están de acuerdo es que los estudiantes no deben ser penalizados por este virus. Todos estamos trabajando juntos para garantizar la flexibilidad a los requisitos de graduación para nuestros estudiantes de último año y la admisión a la universidad. Nos damos cuenta de que no todos los estudiantes tienen acceso a Internet y lo que necesitan para seguir su educación e instrucción. También estamos trabajando con los distritos para asegurarnos de que las comidas escolares continúan durante todo el año escolar. Estamos trabajando con muchos socios para tener cuidado de niños disponible para trabajadores de salud, personal de primeros auxilios y otros trabajadores esenciales. Sé que esta recomendación es difícil para los padres, estudiantes, familias y educadores, pero es lo que tenemos que hacer para ayudar a terminar con este virus y mantener a nuestros hijos seguros. Estoy segura de que al trabajar juntos estaremos a la altura de este tiempo difícil en nombre de nuestros 2 millones de estudiantes en el condado de Los Ángeles. Gracias. Ahora quiero introducir a Mara Suárez del Departamento de Servicios para Niños y Familias.
Buenas tardes. Mi nombre es Amara Suárez. Soy portavoz para el Departamento de Niños de Servicios. Durante este tiempo de intensa ansiedad en el Departamento de Servicios para Niños y Familia, sabemos que nuestra comunidad y familias necesitan apoyo. Quiero asegurarles que el departamento está trabajando las 24 horas para fortalecer familias. La dinámica familiar se verá afectada naturalmente con las escuelas cerradas y la mayoría de familias se están quedando en la casa todo el día. Esta situación seguramente pondrá a prueba los límites de incluso las personas más pacientes. Pero quiero enfatizar que hoy hay servicios de ayuda en su comunidad. En particular, hay una variedad de servicios disponibles a través de nuestro programa de prevención y atención posterior que están orientados a fortalecer y apoyar a las familias. Estos servicios están disponibles para todos los residentes del Condado de Los Ángeles y son gratis. No importa su edad, estado migratorio o si tiene seguro. Prevención busca garantizar que los niños estén seguros, ayudando a desarrollar las capacidades de los padres y ayudar familias a navegar en momentos difíciles. El programa está dirigido a familias que pueden ser vulnerables en este tiempo. Los servicios están disponibles en todo el condado de Los Ángeles. Aunque los servicios varían según la agencia, algunos de los servicios incluyen apoyo y educación para padres, vínculos con los recursos necesarios, bienes para necesidades familiares básicas, actividades centradas en la familia y grupos de acción comunitarios. Durante este tiempo de distancia social recomendada, muchos de los grupos de apoyo y otros servicios están disponibles a través de Zoom o otras plataformas de videoconferencia. Quiero enfatizar que todavía estamos aquí para ayudar y conectar a las familias con los recursos en la comunidad. Animo a cualquiera que pueda usar un poco de apoyo en estos tiempos que se comuniquen con el Departamento de Servicios para Niños y Familias. Estamos comprometidos a publicar recursos a las redes sociales y el sitio web del Departamento de Servicios de Familias y Niños. Nuevamente, estamos aquí para ayudar y estoy segura de que vamos a superar esto juntos. Gracias. That concludes our press conference for today. Thank you.